Hello and welcome to Beyond the Benefits with Savoy Associates. My name is Chris Vanderwolk. I am Chief Compliance Officer here at Savoy Associates. And I'm joined today with my two friends, Joe Bosotina and Vance Sible from Vitable Health. Gentlemen, great to see you today.
Always good to see you, Chris. Thank you for having us.
Joe, if you could, would you mind introducing yourself to the audience?
Absolutely, Chris. Thank you. My name is Joe Bosotina. I am the Regional Vice President of Broker Sales here at Vitable Health. As of today, I cover the majority of the continental United States, but our goal here at Vitable is to bring on 3 or 4 more of me in the next 6 to 12 months.
All right, so your assignment may change, Vance. Your man almost needs no introduction, but would you do us the honors anyways?
Absolutely, Chris. So this is my 39th year, and while it started in Bucas, I transferred over through a lot of TPAs and really got close to the customer and have enjoyed working at Vital. I've come here since December 15th. I chose Vitable because it was the best vendor partner I'd ever found on the TPA side. So look forward to today's conversation and letting people know more about us.
All right, so Vance, with that, let's start with what you said the best TPA partner when you were on the TPA side was Vitable. What is Vitable?
Sure. Vitable is a direct primary care model where we work with employers, be they small groups, be they large, fully insured, or self-funding. It most often supports the self-funding model because what we do is when people use our nurse practitioners and our physicians, there's just a membership fee, which is very small, and we're saving 3 times that amount in the core services we provide. And those core services are simply pick up a phone and call us. We can help support you and get free medicine for you. We can actually come into your home or your work site. So think about Dr. Marcus Welby, MD, in the little black bag. We have mental health. We also provide labs and flu shots. Basically, any use that you would normally go to your primary care doctor currently, we're available for.
All right, Joe, can you expand a little bit about that? How is there a Vitable building the patients go to? How does this work when I'm the member, I'm covered by Vitable? How do I get to you?
Right. Chris, great question. We get that often from our GA and broker partners. So Vitable Health we are virtual first. So we don't actually have brick and mortar. Our value prop in the delivery of our solutions are virtual care first, a diagnosis, and then if needed, based on severity, that we can do in-home. We also do on-site for our employer clients. We offer labs, immunizations, complimentary prescriptions, well over 1,000 today as we have this conversation, and a continuum of care through care navigation and steerage based on the needs, the wants, and the diagnosis of our specialist that's online with one of our members.
All right, so Vance, you mentioned Vitable is a great TPA partner. You also talked about a 3-to-1 return on dollars spent for the Vitable services and what you're seeing in total expenses. Can you talk a little bit about how that works? Because, I mean, people have heard return on investment in so many different ways. How is it real? How does this work? What are the mechanics of it?
Absolutely. So we start with, we're not an insurance company. We charge a membership fee of $30, and brokers can add some nominal amount, $1 to all the way up to $9 additional for compensation. So that would be the total cost for the employer. We've had our program actually attested by one of the industry's leading actuarial firms, Windsor Strategy Partners, and they've indicated that we save about 14.4% in claims. So what that means in real dollars is about $70 to $90 savings, and we're only $30 cost. So we're saving anywhere from 200 to 300% of a dollar invested in us. And it's a much easier program for members to use because there's no claim forms, there's no hassle, there's no copays. It's a very delightful experience.
So no claims forms, no hassles. You go on the website or the app, I guess it would be, not the website. Initiate care. You get a nurse practitioner or a physician either real time, virtually, or house calls. They come to your house. Joe, can you talk about why this is reducing the cost of care for members, other than putting it to Vitable? How does this help reduce my overall cost burden?
Yeah, absolutely. So what we do is we actually eliminate the claims experience, right? So those claims are eliminated and they are sent to Vitable. So again, when it comes to renewal, those claims are never found by the current health plan. Again, whether it's fully insured, level funded, or self-funded. But also what we have found is because there are zero copays and zero deductibles, we absorb those costs as well. So for that $30 per household per month, that literally covers anybody that is under your domicile. So again, Joe's married to Sierra, Joseph, and Michael. I may have my in-laws or my parents living with me. Everybody that falls under my roof is covered under that $30 per household per month.
So we're capping it. We're going to do some navigation, some care coordination as well. Vance, can you talk a little bit about? Oh yeah, you had something else you wanted to say? Go ahead.
I'd like to add, it's just a more efficient experience. If you go to your family doctor now, that family doctor's probably got pavement where you park your car. That needs property casualty protection in case you trip getting out of your car. You have a receptionist. You have all these machines and stuff which may or may not be used by you. We simply send a nurse practitioner who's licensed to prescribe medicine to come and take care of you. And when that's done, they go home. It's a very efficient system. So we pay on an hourly basis to our clinicians rather than a salary, whether they see anybody or not. That's not a good model. So it's very efficient in that means. And that's why we're able to do all of the things we mentioned for just $30 plus commission per family.
So direct primary care is a hot topic on LinkedIn, throughout the industry. Outside of our industry, I hear conversation about direct primary care. There are doctors who are opting out of insurance systems and setting up their own direct primary care practices on a one-off basis, saying, I can take a panel of 400 patients, they can call me. Direct primary care looks different depending on which physician, which platform, which service provider you're working with. But part of what I hear a lot of the benefits are really about access. And now I'm a parent to, my kids are now thankfully out of daycare, but when they were in daycare, they were seemingly getting sick every third or fourth day. I had a lot of times where I'd have to call a doctor, and we already all knew what was up, but I needed to get access to something. So if I have a kid wakes up at 3 a.m. with pink eye and they're screaming, how do I get the doctor? How do I get the pink eye medicine? And how do I get back to my life using Vitable?
So Vance, I'll lead that conversation. So Chris, First and foremost, everyone has one of these, right? Either an Android or an iPhone. So the Vitable app, the member will go on there and sync for service, call for service, or chat for service. So Dr. Vitable would help that member with their child in setting up that first initial appointment. So again, on a pink eye perspective, that's primary care. Sore throat, pink eye, earache, aches and pains, right? So diagnosis would happen, and literally in less than an hour, you would have a virtual meeting, but you would continue to receive messages, emails, and texts stating when a specialist is available, the individual's name, and how he or she will respond. So literally, it's a quick turnaround versus what Vance discussed before, is calling, waiting for an appointment maybe later in the day, getting in your vehicle, maybe having to go pick up your child at daycare or school, taking he or she out of school, and then obviously having to take that time away from your occupation or your job. And that's literally how it works, all within the app, via telephone call, email, chat, and through the app.
Makes it a whole lot more accessible. So, Vance, if I'm fully insured, or if I'm self-funded or partially self-funded, or I am doing an ICRA, or I've got any number of strategies, how do I choose when, where, and how to play Vitable into my benefits package?
I think Vitable can fit with all of those, can certainly fit with fully insured as well. with a high deductible or delightful experience, you could raise your deductible slightly. We talked about being under a self-funded plan. We are going to save your employer money, and we're going to save the employee a tremendous amount of money. Our service is zero copay each and every time that they use it. The best thing is, I think we haven't talked about, but if you're self-funded, we will help steer you to the best either contracted facility, if you're reference-based pricing, or the best in-network facility. So we're always guiding to save the employer and the money, and the member money in the long run. So putting us in just like you would ask your normal family doctor, who should I see for this, that, or the other, when it's a specialist, we're going to be helping in that continuum of care, guiding and following up with them as well.
So there's a care concierge type service involved as well.
Absolutely.
I have no idea. I've never had, for example, I've never had knee surgery. I wouldn't know what to do other than maybe ask some people who had knee surgery. And that's a pretty limited data set.
Exactly.
Chris, what we have found, and there are organizations out there that specifically focus on concierge health, our partners are stating for our price point, concierge with steerage and care navigation at this price point is the best in the industry. I mean, whom else, if you are white collar, blue collar, or gray collar, can literally get same day service, same day referral, and same day care, literally all within an hour or two. And that's the primary value proposition of Vitable Health.
It's a powerful message. So if our audience is mainly benefits brokers, at least we believe it to be mostly benefit brokers. If you're not a benefits broker and you're listening to this, hit me up. Let me know why you're listening, and would love to hear more from you. But I think mostly benefits brokers are listening to our podcast and watching these videos. How can they get more information on Vitable? How can they get a quote?
I would suggest that they call their Savoy rep. Savoy knows about our program and do an excellent job. We can turn around proposals very quickly, usually same hour, definitely same day. This proposal is very straightforward and readable. We would support any broker in presentation. We would support groups of brokers wanting to get together to know about this. We're here. Both Joe and I are in New Jersey. Joe's a little further north than me, but we will drive anywhere, have lunch with anybody just to let them know more about us. This is the biggest secret out there, but this is the next coming of the savings of the industry. First was reference-based pricing. I call that a disruptive savings. We are constructive. We are very supportive. We have a net promoter score of 94, which is kind of unheard of in industry, when our industry sits in the 20s and 30s generally. So we would invite people to definitely reach out to Savoy to find more.
And that net promoter score is over several years, right?
It is. It's very consistent once it reaches that level, and it hasn't peaked yet. It's probably going to be 95.
94 is about where ice cream comes in, I think.
Yeah. Well, so Starbucks is at 38, so ice cream's better than coffee, evidently.
Better, yeah, I would agree, and I love coffee. All right, Joe, do you have any parting words?
Absolutely, Chris. I also would like to share that from a provider metric, on a scale from 1 to 5, 5 being the best, we actually rate at 4.5. So very incredibly confident that our providers, our specialists, our NPCs and our PAs are definitely rated one of the highest in the industry. And also, too, lastly, no geography today can inhibit Vance and I from answering. So if you are a employee benefits broker or consultant in one of the 50 states, please reach out. We'll walk you through the value proposition, those regions where we are the strongest and most relevant, and very rarely will we walk away from a case.
And I would just like to point out, lastly, any RFP that you're working on now that has 20 or more employees, definitely consider Vitable through Savoy's distribution.
All right. Well, we are going to share your contact information as well. And of course, anybody listening can always reach out to their account executive here at Savoy for more contact details as well. Gentlemen, it's been a pleasure seeing you this afternoon. Whatever time people are listening to it, hopefully it's good morning for them. I look forward to talking to you guys soon. Thank you so much.
Chris, thank
Thank
you so
you,
much for your
Chris.
time. All the best to you and the team.